Thank you so much, Kelly. So actually, at the very first symposium, this is our fourth, we decided we wanted to honor some individuals or teams or groups who really go, above and beyond for people who have mental illness and cancer. And so we asked our community, our cancer centers, teams to nominate individuals for what we call the Bridge Award, since we are bridging the divide. And so this year we'll be announcing our winners throughout the symposium today. Typically we have a reception that honors our winners, and so we will have an in-person reception for those winners sometime in the fall. When we hope that we will be able to be connected and see each other face to face again. Our first winner is Dr. Michelle Jacobo. She is a psychologist at the Dana-Farber Cancer Center and was nominated by her colleague, Dr. Alana Braun, who is a psychiatrist at the Dana-Farber Cancer Institute. And this is what Dr. Braun had to say about Dr. Jacobo. Michelle Jacobo is fearless in taking on some of the most psychologically fragile patients in the cancer center, such as individuals with chronic, severe suicidal ideation. She is skillful in equipping patients with new techniques through dialectical behavior therapy and mindfulness. She's also a wonderful teacher for medical teams, helping teams skillfully navigate clinical care with patients with whom they might otherwise struggle to assist. She is a gift to that team at the Dana-Farber and continues to educate throughout the country and the Massachusetts area. And so, Dr. Jacobo, thank you so much for being one of our Bridge Award winners this year.
And I just echo the chat. I very much miss you at Mass General, and I know that they'll convince you to go to Dana-Farber, but I know that you're doing good work there. But yes, we do miss you here.
So I think that Kelly will talk a little bit about our next award winner and give us a little bit of a lead in on him.
Absolutely. So it is my absolute honor to talk about Mike Jellison. And when we think about this year, collaborating with Healthcare for the Homeless has been one of the most rewarding pieces of that job. We have shared two patients, one of whom you might have seen the photo voice earlier. He talks about how he can only taste Ensure and has his picture of Ensure. And so that's what he wanted to show. Mike, as you can see there, has just a gift at really understanding what matters to people and making sure he partners with them and making it work. As it says there, it's a Michael Jellison recovery coach from Mass General and from Boston Healthcare for the Homeless. Michael's involvement decreases isolation and improves quality of life for, let's see if I can't. Can you read it, Amy? I can't see it. There we go. Here we go. Who have and improves quality of life for people affected by cancer, addiction, and mental illness, who have also been rough sleepers. Michael's guidance has been essential to build trust, understand what matters, and creatively and persistently engage people where they are, acknowledging challenges, and also at the same time building on strengths. One of the people we care for together, who has advanced cancer, and has also coped with an alcohol use disorder for his life. He shared, you know what I'm most proud of? I'm most proud of the fact that I got to get out of this hospital and go to work again after I got sick. And after that, I was able to come back and accept hospice. And it is really Mike and his collaboration with the street team that made that possible. He has just demonstrated a unique ability to develop partnerships and to be a tremendous advocate for the people he cares for. And certainly all of the members of the street team echoed the strong pace and essential role that Mike plays on the street team. And we've just been so lucky to collaborate with him. Congratulations and thank you for all of the wonderful work you're doing now and have done in the past. It's really a privilege to work with you.
Well, I'm excited to, to be presenting this award. Let me just find my video here. to one of my social work colleagues, and I'm just, as a side note, thrilled to see so many social workers from our community and around the country here today.
The social work.
Yes, very excited. Always very, very excited to see my friends. So this next award goes to one of my social work colleagues here at in the Mass General Cancer Center. Emily Doerr is a social worker in the Mass General Breast Oncology Clinic, and she was nominated by Dr. Jennifer Shin, who had these words to say about her. Emily Doerr is a wonderful resource for all patients and has been especially helpful to patients with mental illness. Emily used to work on the inpatient psychiatry service and therefore has experience serving the needs of patients with serious mental illness. She's compassionate, dedicated, and readily available for patients and her oncology colleagues. Emily is an amazing team player. And I just have to say that I value so much my oncology social work colleagues. I go to them for resources and you know, curbside guidance all the time. And Emily has been particularly supportive with a number of the patients in our clinical program. So I am absolutely thrilled to present Emily Doerr with one of our Bridge Awards this year. Congratulations, Emily. Kelly, I think you're muted.
Absolutely. It's like an absolute honor to work with Emily, and we're thrilled to recognize her. So we can just take a minute so we were doing positive pauses, right? This is a positive psychology-based strategy that fosters resilience. It's just also good to recognize good stuff happening in the world when there's so much uncertainty. And I'm really excited to recognize someone who I haven't had the pleasure to meet in person yet, but have heard good things about. So this is Zainab Oseni, case manager at Elliott. We've been really thrilled to collaborate more with Elliott on the North Shore this year. It's really been wonderful. Zainab is an especially empathic, dedicated, and determined individual. She has gone above and beyond the scope of our service to be there for her client, ensuring that the client is able to access and understand her medical appointments. Zainab has truly given her client hope that she can not only endure her disease, but that she can also continue to thrive and experience joy. Wow, that's really beautiful and so important. You know, and we in the fall, hopefully, will be gathering more in person to more formally and fully celebrate all of the Bridge Award winners. But we also just wanted to take that moment to pause today. Congratulations, Zainab. So I just wanted to start by, again, this is our positive pause, so I'll take a deep breath too. It's good. I have had the pleasure of working with Caitlin for a few years at Freedom Trail Clinic, and she, even from the first day, has just been such a thoughtful, considerate nurse practitioner who really cared about health prevention. And as Sarah McLaren writes here, a committed and compassionate provider who advocates tirelessly for her patients to ensure that they receive appropriate cancer care. Caitlin not only cares for patients during their cancer treatment, but also works in cancer prevention. She has led smoking cessation groups the last few years and collaborated with Dr. Efren Flores and me to increase access to lung cancer screening for those with serious mental illness. And I also just want to say that we've also shared some patients with cancer, and she really has gone above and beyond to be such a wonderful collaborator, even after her patient has died. And so congratulations, Caitlin. It's very well deserved.
Thank you so much, Kelly, and congratulations, Caitlin. So I would want to take a pause here to share a personal narrative from an individual who we're very excited to have share in his own words what his experience has been like. Daniel Sullivan, I met a couple of months ago, and it was just a delightful conversation about what his experience with cancer and mental illness has been. And I'm incredibly glad that he was willing to share some of his words today. And so here are Daniel's words about his pledge to make sure that mental illness is never a barrier to cancer care.
All right, hello. My name is Dan Sullivan, and I pledge to ensure that mental illness is never a barrier to cancer care. I consider myself very lucky. I was able, with the help of a lot of people, including my psychiatrist, my prescriber, if you will, but I was lucky to manage to retire with great insurance, and that enables me to have the greatest care that I could ask for. But that not only that, but I'm very, very lucky, and everyone should be so lucky to have family and friends that really, really care about me, and I'll know that I'm not alone. And I thank God for that.
Thank you so much, Dan, for sharing your story. We feel so lucky and happy to have you here.
I've had the privilege of working with Alejandro Pichardo, who is a navigator in the Mass General Cancer Center, who is doing incredible work on the front lines to enable people, many of whom are Spanish speaking, in the hard-hit community of Chelsea to access care. He's had 3 COVID positive patients that he's cared for. He grew up in the Dominican Republic. He has a very, very strong commitment to doing what is right. And he actually was just admitted to a bioethics fellowship. And it has just been such a privilege to see his commitment and dedication to ensuring that all the community members and patients with cancer are able to access care. And now we're going to transition to Senator Cindy Friedman, who is our last positive pause before our panel about policy in this time of real crisis. I was so lucky to get connected to Senator Friedman, my collaborators at NAMI Mass. And she has been a steadfast advocate who gets it, who understands, and has been a leader to ensure that mental health is healthcare. She's put out a wonderful act, if you haven't read it, the Mental Health ABC Act, that lays out key strategies for us to get closer to mental health parity. And she is also just someone on the ground doing all the work that's needed to make that happen. So we're so honored to recognize you. Congratulations, Senator Friedman, and thank you for all of the work you're doing to ensure resources right now, free up emergency funding, and also keep mental health on the radar